Okay. Hi, everyone. Thanks again for being here today. My name is Amy Salazar. I'm an assistant professor at Washington State University in Vancouver, and I am part of the executive leadership team for the National Research Collaborative for Foster Alumni in Higher Education. Thanks for joining us for our web series today. Just as a reminder, this webinar today will be recorded and put on the NRC FAHE website. If any of you are not already on our listserv and are interested in joining, please go to our website, which is here on the screen, www.nrc-fahe.org, and you'll see a subscribe button on that first page. So just a little bit about our future webinars. After today's webinar, we'll be taking a break for the summer, and we'll be back with you in August. So on August 24th at noon Pacific time, Dr. Angelique Day, who is also part of the leadership team for the NRC FAHE, will be presenting. She's from the University of Washington, and she'll be presenting on some upcoming federal legislation for foster care and higher ed. And on September 23rd at noon Pacific time, we'll be joined by Dr. Regina Gavin-Williams, who's at North Carolina Central University School of Education, and she'll be talking with us about a program that they have there. Okay, so for our agenda today, our presenters will be presenting for about 30 to 40 minutes on their recent research work in this area. And then we will have a Q&A time after the presentation. So if any of you have questions that come up, you don't need to hold them to the end. You can go ahead and type them in the chat box, but I will hold on to all of those and bring them up to our presenters at the end of the presentation. So feel free to type those in at any time. Okay, so excuse me. So we have two presenters for today. We have Dr. Jennifer Geiger, who's at the Jane Addams College of Social Work at the University of Illinois, Chicago. And we also have Dr. Nathanael Okpych, who's at the University of Connecticut School of Social Work. So I will now hand it over to the two of you.
Thank you, Dr. Salazar, for the warm introductions and for inviting us to present our work today. I know Nate and I are really excited to talk about this study and share it with you all who are doing the work on the ground, doing policy work, and doing the research out there. So we're excited to share this study with you and have a discussion with you at the end of the presentation. So first, we want to acknowledge our funders for this study, the University of Wisconsin-Madison Institute for Research on Poverty, or IRP, as well as the U.S. Department of Health and Human Services Assistant Secretary for Planning and Evaluation, or ASPE, provided funding for this study to allow Nate and I to work on this study together. Our agenda for the presentation, I'm going to give you a little bit of background and context. I don't want to spend too much time on that. Many of you are familiar with some of the research that's out there. We'll talk a little bit about the study purpose and the design. Nate's going to share the study findings with you, and then we'll move into summarize those findings and talk a little bit about what that means in terms of practice and policy. And of course, we'll have some time to do some Q&A. So as many of you may know, there is very limited national data on the educational and employment outcomes for youth with foster care histories. What we do know mostly comes from, or does come from, data from the Midwest study and Cal Youth study that shows that about a third of former foster youth or youth with foster care histories are neither working or in school at the age of 21. And by the age of 25 or 26, about half are employed when compared with about 70% of the general population. We know a number of factors contribute to some of these numbers or disparities in those numbers when comparing youth who have foster care experience and those who are in the general population. Research shows that it's related to a lack of preparation for post-secondary education or employment, homelessness or housing instability, a lack of that family safety net or that social support network that many of us have, mental health and experiences around trauma associated with foster care or maltreatment, early pregnancy or parenthood, as well as placement and school instability. There are some policies, though, fortunately, that do target youth in care and youth who have exited foster care or transitioned out of foster care to help promote post-secondary education and employment opportunities. So just want to give a quick overview of what those are, because these are some of the policies that we were looking at in our study. Some of them are going to be more familiar to you, those of you working in the field and doing work in this area. So the first one is extended foster care. There's about 3/5, I think, of states that offer some form of extended foster care, meaning that youth who age out at the age of 18 typically can elect to continue receiving services from the state or from the child welfare agency. They typically include some type of housing assistance or financial support, case management, really varies depending on what state they're living in and receiving those services. What we know about extended foster care is that it's been shown to have some positive impact on high school graduation, college enrollment and employment. We're still kind of seeing some promising results related to employment, but we still need to learn more about that. State tuition waivers, about half of the states across the US offer some form of tuition and fee waiver for post-secondary education and training. Again, it varies quite a bit for those states that do offer some sort of fee waiver or tuition waiver. Some have different requirements or qualifications and eligibility, just really depends. Versus some states have kind of anybody who experienced foster care can be included and be eligible for this type of tuition and fee waiver. Some of the earliest and most comprehensive policy is we refer to as the Chafee program, or the Foster Care Independence Act, which allocates funding to states to offer different independent living skills, programs, services to youth in care, and as they transition out of care. And then also the educational and training vouchers, or ETV as we'll refer to them, offers funding specifically for post-education and post-secondary education and training for youth in care, as well as youth who have exited from care. Again, there's some variability there depending on the eligibility, but the federal laws kind of dictate in terms of what some of those requirements are as well. Some different programs that are offered while youth are in care vary again by state, which is, we're going to be looking at some of those variations and whether that makes a difference, but they can be defined in different ways. So we have educational and financial assistance. So pretty much self-explanatory. These are scholarships, student loans, grants, different types of stipends, et cetera. Employment training, this is typically through Chafee funding. This could be job placement, internships, career development, job readiness programs, job coaching, just to provide some examples. Post-secondary education training has to do more with things that are specific to post-secondary education. So things like college counseling, tutoring, providing information about financial aid, those types of things. And then services while in extended foster care. These, of course, are related to case management, financial support, housing, different types of supports while youth are in that extended foster care period. So we know that educational success, so high school graduation, receiving a GED, and post-secondary education and training lead to improved outcomes around education and employment. But what we don't know is what are the roles of some of those youth characteristics and the policies and programs that I've described in promoting post-secondary education and employment using a national sample. So our research questions that we looked at with this study are, do state level policies, and specifically extended foster care, ETV, tuition waiver, and Chafee funds, do they increase the odds of youth connectedness at age 21? And secondly, at youth level, so looking at individual characteristics, do services and resources from those policies increase the odds of connectedness at the age of 21? And finally, we wanted to know about some of the disparities by youth characteristics in terms of connectedness at the age of 21.
All right, thanks, Dr. Geiger, for that intro. So I'm going to be talking about some fun stuff, the survey methods, how we measured our variables, and then the findings of the study. So we use data from the National Youth in Transition database. And as Dr. Geiger mentioned, this came from the 1999 Chafee law. So starting in 2011, states are required to collect data on a representative sample of youth in their states who are 17 years old and in care. And so we're analyzing data from the second NYTD cohort. These are young people who were in care at age 17 in 2014. And follow-up interviews were conducted with them in 2016 and 2018 when they were 21 years old. So for this analysis, we limited the study to about 7,800 youth who completed the first first NYTD survey and the age 21 NYTD survey. So since, as Dr. Geiger mentioned, we're interested in both characteristics of the youth and then also characteristics of the state where they're in foster care, we used multi-level modeling. Specifically, we used a multinomial logistic multi-level model because our outcome is going to have multiple categories. And we developed survey weights so that our sample of 7,800 youth reflects the gender and race distributions within each state of the entire NYTD population that was eligible for this study, which is about 24,000 youth. And we also used a sophisticated method for accounting for missing data called multiple imputation. And these last two things are important, the survey weights and the addressing missing data, because what we try to do is preserve as much of the sample as possible and to make our sample as close to the overall NYTD population as is feasible. As the more youth that are dropped or excluded from analyses, there's a chance that biases could enter into both the measure of the outcomes and then also the relationships between the predictors and the outcome. All right, so what we're really looking at is what is the role of state level policies and programs? What role do they play on youth connectedness in employment and education at age 21? And we're also looking at a lot of different youth level characteristics, which I'll briefly summarize in a moment. All right, so for our outcome, we had two measures. First measure is opportunity youth, and this is all about youth education and employment status at age 21, so at that third NYTD survey. So first measure is a simple binary measure. Opportunity youth are those who are not working or enrolled in school at age 21 at the time of their interview. And the comparison group includes youth who are working or who are enrolled in school or both. So the measure that we're going to be focusing on today is the second one. This one's a little bit more nuanced, and really what it does is it looks at the type of connectedness that youth have to education and employment. And it breaks down into it breaks youth down into four different groups, four mutually exclusive groups. So first we have youth who at age 21 were not working and not enrolled in school. We have a second group of youth who were just working. We have a third group of youth who were only enrolled in school. And finally, we have a youth that were doing both. They were employed and they were enrolled in school. And as Dr. Geiger mentioned earlier, this is one of the strengths and innovation of this study, because most of the studies in the past look at employment or education, but not both. If we're looking at college outcomes for youth at age 21 or above, and we don't have a measure about their employment, well, one of the reasons they may not be in college is because they're working instead. All right, so in terms of predictors, the state level predictors are listed on the box in the left. In the youth level predictors, there's a lot of them. Didn't want to make your eyes roll, so just listed the categories on the right. But in terms of the state level, first one is whether or not the state that youth were in foster care in, did they have a federally approved extended foster care law at the time of the youth's 18th birthday? So basically, was there a law in place when a youth turned 18 that would allow them to participate in extended care? Second measure is a state tuition waiver. Specifically, this measure is whether there's a state tuition waiver available to foster youth in 2016. In this one, there are some states that had no waiver, some that were available to some youth, and then some states had a waiver that were available to all youth. Those were the three categories we looked at. And then our last two measures are about the percentage of federal funds that were used. So first, of all of the millions of dollars that each states are allocated by the federal government for Chafee services, what percentage of the funds were used? Second one is for the ETV funds, what percentage of ETV funds that states were given by the federal government, what percentage were actually used? And both of these measures came from information that we gathered from the Children's Bureau. At the youth level, we have, again, a wide range of predictors. One is how many years did youth actually participate in extended care? And that could range from 0 years to 3 years if they stayed in care all the way to their 21st birthday. We looked at a number of employment, post-secondary education, and educational financial support. And all of these were services and supports that youth received between age 17 and age 21. We also looked at youth demographic characteristics and a host of other risk and protective factors that came from the NYTD data. We also linked it to AFCAR's data, so we have a number of measures from AFCAR's data. This includes things like were youth enrolled in school at age 17? Were they employed at age 17? Several characteristics about their foster care history, such as their placement and stability. Whether or not they were ever referred for a substance or alcohol use disorder, were they ever incarcerated, in several other risk and protective factors. Importantly, we also controlled for whether or not youth received employment in post-secondary education services and aid before age 17. This is something that would help to control youth's proclivity to receiving those services rather than the effect of those services themselves. All right, so when we're looking at outcomes, what percentage of youth were connected to employment or education at age 21? What we see is that almost 70% of youth were in school or working at age 21. And this pie chart breaks it down a little bit further. This is our 4-category outcome. About 31% of youth were neither enrolled nor working. We see that the largest share of youth were only working. About 41% were just working. 11% were just enrolled in school. And then finally, 17% of youth were both employed and enrolled. And again, this is at the time of their age 21 interview. All right, so the next several slides next 4 slides, we're going to walk through which of the predictors we found to be statistically significantly associated with youth's odds of being connected. Because this is a research and a practice audience, we didn't include all of the relative risk ratios. If you're interested in those, we'd be happy to present those, send those to you separately. But really, we're just looking substantively. What are the predictors that are related to the outcomes? So this slide is going to show what services that youth received between age 17 and 21, and what state policies that were significantly associated with an increase in youth's connectedness. And in all of these analyses that we'll be showing in the next 4 slides, the reference group in terms of youth's connectedness is we're going to be comparing with youth who were neither enrolled nor employed. All right, so first finding is that youth who received post-secondary education services, they were more likely to be employed and enrolled than to be disconnected. And as Dr. Geiger mentioned before, these are really services that are designed to help youth enter and finish college, things like SAT prep, counseling, help with financial aid in college applications, tutoring while in college. We also found that youth who received education aid were more likely to be enrolled in college, more likely to be connected to both school and employment. And consistent with some previous studies, the more time that youth spent in extended care was associated with greater connectedness across the board, whether they were just working, just enrolled in school, or both. And then finally, in terms of state policies, we've only found one statistically significant association. And that's specifically for youth who were residing in a state that had a tuition waiver that's available to all youth. They were more likely to be enrolled or enrolled and employed than youth who were in states that had no tuition waiver. All right, so let's talk about some other youth characteristics. These are characteristics that increase youth's likelihood of being connected. We did find a gender difference. Males were more likely than females to be only working. And conversely, females are more likely than males to be connected to work and school than to be disconnected. We also found a difference by race. So Black youth were more likely than white youth to be enrolled and employed at the same time. We also found that youth who had ever been adopted or were in a guardianship placement, they were more likely to be employed and connected to both school and work. And then a few other factors looked at youth's current status at age 17. So youth who are working at age 17, they were more likely to be connected later on. And youth who were enrolled in school at age 17, they were more likely to be connected to work and connected to work and school. And youth who completed a diploma or a GED at age 17. So these were the early completers. They were more likely to be working later on at age 21. All right. And then finally, this is a counterintuitive finding. So youth were asked if they had ever experienced homelessness during their age 17 interview. And youth who said, yes, I have experienced homelessness at some point in my life, they were more likely to be enrolled than youth who had not experienced homelessness by age 17. So that's an interesting finding. Maybe we can talk that out in the Q&A. All right, so the next two slides are going to look at our predictors that significantly decreased youth's connectedness, right? So there were a few findings that had to do with youth's foster care history. So youth, for each additional year later that youth entered foster care, each additional year that youth were in foster care, and then also the number of different foster care episodes that youth experienced, all of these decreased the likelihood that youth were connected to both school and work compared to being disconnected. Consistent with previous studies, we also found negative effect of placement change rate. So youth that were in more foster care placements per year, each year that they were in care, they were less likely to be employed, less likely to be connected to school and work. We also found that looking at removal reasons, youth who were removed because of a behavior issue, they were less likely to be enrolled. And we also found one negative effect of receiving services. So youth who received career preparation services between age 17 and 21, they were less likely to be connected to both employment and enrollment compared to youth who did not receive these services. And these services were really about developing youth's ability to find work, apply for work, keep employment. So things like career assessment, job seeking, placement and support, how to work with employees and customers. It's another interesting finding that maybe we can talk about in the Q&A. All right, so last slide with the findings. We also found that youth who were either received a referral or treatment for alcohol or substance use, they were less likely to be enrolled and employed. Youth who had been incarcerated before age 17, less likely to be employed and connected to school and work. Young parents, so youth who are a parent at age 17, less likely to be connected to both school and work. And we also found several findings around youth that had different disabilities. And these are disabilities that came from the AFCARS file. So youth with intellectual disabilities, they were less likely to be employed and connected to both school and work. And then youth with other medical conditions, they were less likely to be connected across the board. And this other category really does encompass a wide range of conditions. Unfortunately, AFCARS doesn't break it down to be more nuanced, but it includes things such as asthma, autism, cystic fibrosis, diabetes, hypertension. So it really is kind of a catch-all category, which makes it a little bit difficult to specifically interpret this. All right, and I'll pass it back to Dr. Geiger.
I get the fun part of talking about the limitations, Nate. As with any study, there's going to be some limitations to just consider when thinking about some of the findings that Nate's just presented. First, we included a lot of different characteristics and demographics, but there was obviously some that were not included in the analysis. We didn't have some important information about high school grades, mental health problems, or other sources of funding, such as Pell Grants, for example. There's some issues around indigeneity when we're thinking about extended foster care and connectedness, kind of thinking about like what came first or what led to one or the other. Was connectedness associated with different factors associated with extended foster care or vice versa? One of the biggest things that we realized after completing the study and really thinking about some of our findings and the lack of, the lack of interesting findings around state level factors is that we were looking at Chafee funding and unspent Chafee funds and realizing that those might not be the best measure to use when looking at the impact of those programs. Of course, that's the information that we had, but really a better measure would have been maybe the amount of or the amount of funding that is spent per youth each year, and really looking at some of the programs that they do spend money on and looking at some of those different categories versus the percentages, because without going into too much detail, a lot of the states use a significant amount of their funding. So in year to year, there's no explanation about why they might or why some of those numbers had changed. Receipt of services and funding was a yes or no response. And so it doesn't really account for some of those issues around dosage or how much services or different types of services or at what time those services were received by the youth. And the different amount of funding. Connectedness was only assessed up to age 21. And we know that in general, youth with foster care histories have more of a non-traditional path towards post-secondary education and employment. And we know sometimes education can come after employment or part-time employment, full-time employment. Some of these things can be interchangeable and change at different times. And so it's really hard for us to assess whether some of those outcomes were related to degree completion. So just to summarize, I just want to do kind of a quick overview of some of the highlights of the findings. There's definitely some strengths of the study where some things were kind of brought to light to help us understand some of the characteristics in the past that youth might take. We were fortunate enough to look at education and employment versus just looking at education and employment distinctly. We looked at a wide range of youth characteristics and some of those really relevant policies associated with education and employment. And we were able to capture more of, instead of dropping some of the data due to missingness, we were able to use multiple imputation to be able to include a larger number of participants in the study. Overall, at age 21, about 2/3 of youth were connected to education and or employment, which is promising. The largest group was only working, about 41%. Some were going to school and working at 17%, and the smallest group was those who were only attending school at 11%. Still though, 1 in 3 youths, or about 31%, were neither working nor employed, which is something that we really need to pay some attention to. Of course, we only know the numbers. We don't know some of the reasons. We can speculate and think about some of those reasons. They might be caring for children or other family members. They could be, lacking human development, or human capital. Some of those job training skills that might be important during that time. So we have to think about what some of the other reasons might be where we might be missing that group of young people. So we also, in thinking about some of these policies, we do know that extended foster care policy is something, as I mentioned earlier in the presentation, is promising in looking at some of these positive outcomes, but just simply having that policy may not be as influential as youth receiving and benefiting from the program. So thinking about the time spent in care, how much they were able to take advantage of some of the programs and support that's offered through extended foster care. Participating in services and programs while in care was found to increase connectedness to education and employment. Youth residing in states with a tuition waiving program available to all, which is an important distinction, that they were more likely to be enrolled in post-secondary education and to be employed and enrolled in post-secondary education. Youth who had been employed, enrolled, or who had completed high school or GED by the age of 17 were more likely to be connected. And I'll talk about some of the implications for some of these highlights as well in the next couple slides. We learned that there continues to be some disparities in enrollment and employment outcomes for youth with disabilities and potential barriers among youth who are parents, who have a history of incarceration or substance abuse treatment. And there was a couple of different issues around youth foster care experiences and how they were also associated with their connectedness. For example, the age at which they entered foster care, the time they spent in foster care, and the number of foster care episodes. So what can we learn from some of these findings? Where can we kind of go from here? The fact that there were no other state level policy effects found, it was more about the youth receiving those services and supports that were available through those policies, really highlights that those policies are still very important. However, we need to learn a little bit more about some of those nuances and details more about those programs themselves. For example, the extended foster care, some of the Chafee funded post-secondary education services and education aid. An important finding points to, we know very little about some of it. We're just learning a little bit more about what the impact of some of these tuition waivers are. But what we found is that if it's a waiver that's available to all youth who have foster care histories, that might be an important promoter of post-secondary education employment for youth with foster care history. State policies are important, but it's really important for us to improve the accessibility, the participation, and completion of those programs, such as extended foster care, independent living services, ETV, and helping us to identify what some of the barriers might be. So when we think about different criteria, eligibility criteria for these programs, and how are we connecting to youth and engaging them in these types of programs are things that we need to think a little bit more about and be creative about with young people. Connecting youth early, intentionally, and consistently to those education employment services and programs. So as we saw in the findings, those youth who have been receiving some of those programs around post-secondary education services and employment training and those types of things, who had received them earlier on prior to leaving care, were more successful, or I should say more connected to post-secondary education and employment. And I think it's important for us to think about how we might examine policies that lead to some of those disparities or might create barriers for some of those subgroups. For example, youth with disabilities, parenting youth, thinking about how we might increase accessibility for young people with disabilities or who might be parenting among some other subgroups, that there's some barriers that maybe they don't qualify for some of these different services, or maybe they're not available in a specific geographic area that they might be living in, and we might need to think about how we can increase those, the accessibility and their ability to complete those programs. This kind of goes without saying, but really to ensure that we're promoting stability in care while youth are in care in terms of education, but also placement stability, looking at different creative ways to increase and ensure permanency for young people, and making sure we have affordable options around employment and post-secondary education options for all youth. And realizing that there might be some youth that need extra support with being connected to post-secondary education and employment, where some barriers, again, might already exist when thinking about young parents, those who have juvenile justice involvement while they're in care or during that transition to adulthood, and also what we know about some of those barriers. We have to think about how we might connect them to some of these services and supports throughout the transition to make sure they have better employment and education opportunities later on. Thank you for your attention today. I think we have some time for questions and answer session.
Great, thank you so much, Jen and Nate, for your presentation. So I'd like to go ahead and ask everyone, if you have questions, go ahead and type those in the chat box. You can just private message me or send them to the group, either one. So I'm going to start out with some questions that have already come in. There's two that are similar, so I'm going to combine them. So two people had questions about some of the more surprising finding or the counterintuitive findings. So for example, the piece around students who experience homelessness being more likely to be enrolled, and also students who had received the career support services as not being helpful. So if you just have any thoughts about why those things might have come up. Uh-oh, did we lose our presenters?
It does look like Nate is frozen and the other did drop.
Okay. Well, let's just hang out for 1 second and hopefully our presenters, maybe they're just having some internet issues and they'll be able to join us back in just a second. And while we're waiting, if you all want to go ahead and type in any questions that you have, and then we'll have those ready to bring up when our presenters rejoin us. And sorry for the pause. Nate, I think I might need to make you a co-host again.
Okay, there we go. Sorry about that, folks. I'm in Connecticut right now. We have a storm coming through, so hopefully the internet connection will stay stable. So I was talking a little bit before about the career preparation services, and one idea that we had is that it may be that youth who kind of really need these types of services are the ones that are being disproportionately referred to these programs to learn these kind of basic skills. So these are youth that may not have ever been employed. There may be some need that's identified in these youth. So we may not be looking at the effect of these programs, but more about kind of the type of these youth who are being referred to those programs. That's our thought about the career preparation services. The homelessness, that was a puzzling one. And Jen is back too. All right. One thing that we were thinking about this is it may be that having earlier experiences with homelessness may really kind of steal and kind of strengthen youth about just the importance of finishing their education, kind of build resilience, right? I've gone through really hard times. I've been homeless in the past. I'm going to school and nothing's going to stop me. That was kind of our thoughts about those two findings, but it would be great to hear what other folks think about that if you have any insights.
Great, thank you. And I'll keep my eye out for those, but we'll go ahead and go to the next question, which is, could you say how employed was operationally defined? What counted as being employed?
Right, so in this case, in NYTD, they asked youth two questions about employment. Is the youth, are you employed full-time, which means are you working 35 hours a week or above? Or are you employed part-time, which is below 35 weeks? So for this study, we counted either one. If youth were working full-time or less than that. Unfortunately, NYTD doesn't get into the required questions of NYTD doesn't get into too much more detail about that. But that is how employment was measured.
Great, thank you.
Yeah, and just as a point, the majority of youth who are working full-time. About a little over 60% were working full-time.
Well, thanks.
Mhm.
So Svetlana did have a comment about homelessness that I'll read out. She said, it seems that this study looked at this item at age 17, and this item refers to lifetime history of homelessness. So it might include family homelessness. And this might be different than looking at youth's own homelessness that could potentially help explain some findings. So thanks for that, Svetlana. Okay, next question. Does education include 2-year, 4-year certificate programs, et cetera? Or that's next question, or what's included for education?
Right, so the NYTD question, again, I wish we went into a little more detail, but there was basically one question about youth's current enrollment in school. It says, are you currently enrolled in school? That includes high school, GED, post-secondary education, also vocational training. It doesn't distinguish between those categories. So if at age 21, they're most likely not enrolled in high school, but they could be enrolled in GED. Most of them are probably enrolled in a vocational training program or post-secondary education. That would be my guess from other studies. But unfortunately, we're not able to distinguish that between the types of enrollment.
Okay, thanks.
Mhm.
And then the next question is, some states limit support for certificate programs, et cetera, to 18 months of assistance or until youth reach 21. Do you think that has any impact on the percent of youth reporting being in each category? So education, working, both or none?
Do you mean, well, maybe, I guess I'll think about that question. I wonder, so would you think that more people would be jumping to, complete that program before it's something that they might be ineligible for before the age of 21? I think that could have an impact. I don't know, that's a good question to think about.
Kiara, did you want to add anything to that?
Yeah, I can add. I guess I was just thinking about, particularly in the state of Connecticut, I guess if it was after that breakup or after that breaking point of 21 and no longer receiving support, youth might continue in a program if they were in the middle of it, but they might also drop out of it or plan to finish a program by 21. Just in my personal communications with some youth.
Yeah, I think that's a good point. It very well could be, right? If a youth, let's just say, finished a certificate program, or they basically maxed out of the program if there was an 18-month limit. The outcome measured at this time today. At this time, are you enrolled in school or are you employed? Didn't ask about school or employment over a period of time, for example, in the last year or so forth. So those limitations in states that have them, they could influence the percentage of youth that are connected to school or work.
Thank you. So there's another question or two people kind of asked similar questions, so I'll combine them. So essentially the question is about your finding that employment by 17 seemed to be important for a lot of positive outcomes. And one question just had to do with what would you recommend child welfare systems prioritizing early employment experience? And another question had more specifically to do with the fact that group homes sometimes prohibit early employment experiences. So what are your ideas about kind of next steps for those things?
Yeah, I think what it really highlights, I think, is that youth need to have options. And so I think early employment for anybody, those who've experienced foster care or not, having those early employment experiences can be helpful in post-secondary education settings, but also employment settings later on. So I think just having those different types of options and having restrictions around that. I mean, I get some of the reasons around that, but I think we really need to look a little bit closer at some of those policies that we have that are more restrictive around those activities, which are, more normal, quote unquote, experiences for many adolescents and young people. So I think at a lot of different levels, we need to look a little bit closer at those different policies and see how we might be a little bit more flexible to encourage different options for young people so that they can be more successful later on in those specific areas.
Yeah, and I think those early work experiences, one is they allow youth to develop important skills, not just with doing their job, but also just showing up to work on time, keeping a schedule, things like that, which is separate from high school. High school is very structured. This is something which, there's a lot more independence. You're a lot more on your own. It's kind of like working, later on, and also in college where there's a lot more independence. So developing those skills early on, but in a lower stake setting, right? At age 21, 22, if a youth has a job and they miss a shift, that could be it. They could be fired. At age 16, at age 17, you're learning those skills in an environment where the stakes aren't quite as high, especially if they're still in foster care and they have a roof over their head and food on the table.
I think too, some of those opportunities allow for us to grow our social networks, right? So thinking about how you can get to know different employers, coworkers, and kind of just expand that, that network of people that might be helpful in getting you into these different post-secondary education and training settings, and also different employment opportunities that might come along later on.
Yeah, I just said kind of on a personal note, I remember one summer I worked freelance construction and my job was to shovel rocks, pull out asbestos from ceilings, making at that time probably like $7 an hour. Other times I worked at a food store and I had, around Thanksgiving time, people throwing frozen turkeys at me when the discount wasn't taken off correctly. And I said, okay, I want to go to college. I want to go to college. So it could be motivation as well. I really appreciate the kind of the importance and the value of school and of getting those skills to wind up in jobs where, you're really satisfied. You don't have turkeys thrown at you.
Thanks for that. So the next question is, I'm a CASA volunteer and I'm wondering if there's a comprehensive list somewhere of steps that should be taken to help prepare youth that are about to age out of foster care. That's a big question.
That's a big question. I don't know of that list. I would love for somebody to put that together for us. I think, I think some of it could be state specific, right? So, and it's first thinking about how do we start talking to young people about their different options. I think, too often we want to push everybody into go to college, go get your 4-year degree. But I think that we need to think about like what makes most sense for that specific youth or young person, and how we might best prepare that person in giving them those different options, right? But some of it is state specific when you think about different financial aid packages to do these different programs, whether it's education or training programs or employment training, all of those kinds of things. So, hopefully some of your welfare agencies or community agencies have some of those either programs and or lists. But I would say engage with some of those youth serving organizations in your community and partner with folks who do this kind of work. I know that there are some agencies that put those lists together, and I think that's really, really helpful for us, as we learn about those different opportunities, because they do change a lot. I don't know if anyone has any other insight about that, or Nate, what do you think?
Yeah, I'd say, we got a lot of folks in the room that are experts, and if you have kind of a good list, feel free to post it in the chat. I know John Burton Advocates for Youth, this is based in California. They have a great website. A lot of it is California based, but they also have some reports that are more general. So that would be a good place, I'd say, to start. John Burton Advocates for Youth, and I could post the website in the chat.
Thank you. So the next question is a data question. So did you use the weights provided by Indican? Nate had said previously that you had developed them. So just curious what you meant by that.
Yeah, so we didn't use the weights that were provided by NCANS. We followed the instructional video about creating the weights, and it was several days of sitting lonely in a quiet place, doing some very painstaking work. But we really wanted to customize the weights because we were interested in making sure our sample was reflecting the larger population in terms of gender, in terms of race and ethnicity within each state. So we created some customized weights, and also it's a little more complicated than what I described earlier, but there's also issues of non-response. There's issues of some states decided to, for the follow-up interviews, to take a random sample of youth. Other states tried to interview all the youth in the baseline sample. So the weights accounted for all of that stuff. And if you want to know more detail about it, please feel free to email me, and I can be happy to share.
Thank you. So right now I have one other question, which is, can you share some thoughts about what we need to do for the 1 in 3 youth who are neither working nor employed?
I think that's one of those bigger questions, right? I
Yeah.
think a number of different things we can do. We talked about a couple of them is, again, starting early or making sure that youth are connected to some of those programs while we still have them as a captive audience, so to speak. So, between the ages of 16, 18, even 21, making sure that appropriate services are accessible to all youth, and making sure that we are referring youth to these programs appropriately as well, and not just thinking like who might be high risk or not at risk, who might be more likely to do this or that, but really sitting down and looking at individual plans with young people and thinking about what they might want to do. I think that's one thing. There's things like on a programmatic level and then also on a policy level that we can look at.
And then just to kind of to piggyback on what Dr. Geiger said, I think a lot of it is about relationships, right? When youth, as a lot of youth are aware, some of these youth have gone through a lot. There's been just a turnstile of relationships from one to the next, and that includes, sometimes you have individuals who are in their lives that may be very well-meaning and well-intentioned, but there's a lot of resistance, what feels like resistance. So just finding some individuals who are really going to be there, going to stick it out, that understand the role of trauma, and that sometimes when a youth initially pushes back, be persistent in building that relationship. I think it's going to start with that relationship, and then ultimately it will lead it to a mentorship relationship about, okay, what are your interests? What are your strengths? Let's make a plan. Let's walk this together. I think those relationships are incredibly important.
Okay, well, I haven't had any other questions come in, so I think we'll stop here. So thank you so much, Jen and Nate, for your presentation today. I really appreciate you taking the time to join us, and thanks everyone for coming. Just as a reminder about if you aren't already on our listserv, please sign up to hear about our future webinars, and we will be posting the recording and slides from today's webinar on the NRC FAHE website. Thanks so much, everyone.
Thanks for having us,
Thanks,
Amy.
everyone. Thank you.